Hi, this is Dr. Saravanan, surgical gastroenterologist, laparoscopy and laser surgeon, also GI cancer surgeon. Today I will give you a bird's eye view on gallbladder stones, the pathogenesis, signs and symptoms, what are the investigations to be done on the treatment for the gallbladder stones. There is so many myths and misinformation among the common people. To clear these and to clear the doubts, this will help, a small interview will help about the gallbladder stones. Gallbladder stones is one of the most common diseases causing abdominal pain. It affects all the ages, from children to elderly people. It affects not only the gallbladder, the storage organ of bile, but also the liver, common bile duct, pancreas. Sometimes even the small intestine is also getting obstructed by the gallstone disease. It is one of the gold standard, or laparoscopic cholecystectomy is one of the gold standard treatment. But I recommend this. It should be done by the surgical gastroenterologist because of a lot of variation in the bile duct, the gallbladder regions, or the blood supply to the gallbladder itself. There is so much of variation. This has to be identified and cleared. This will be done only by the expertise like an experienced surgical gastroenterologist. And it is highly curable disease. But negligence on the part of the patients will cause a lot of complications, multiple procedures, and even ICU admissions. So let's see how the gallbladder stones is formed. Gallbladder stones is formed due to a complex interaction of environmental, diet, and also bile infections, and some sort of genetic component is also present in the etiopathogenesis of gallstone diseases. Normally, the bile is needed for the fat digestion, which is secreted by the liver and getting stored in the gallbladder. And the bile is in a thick, viscous liquid. It is in a liquid form. But when the solutes in the bile increases, like cholesterol increases, calcium increases in the concentration, then the gallbladder stones is formed. It is formed due to unhealthy, high caloric, high fatty diet. The bacterial infection in the bile also causes gallbladder stones. So this is a common complex interaction of diet, lifestyle, and also the bile infection, the sedentary lifestyle causes gallbladder stones. Coming to the people at risk, obesity is the first and foremost cause of gallbladder stones formation. The obesity causes increased cholesterol in the bile, which leads to the gallstone formation. And not only the weight gain, especially the central obesity, the truncal obesity, that causes more gallstone formation. And some of the people nowadays adventure into bariatric surgery. It is also helpful, but the certain weight loss due to the bariatric surgery also causes gallstone formation or sludge in about 30% of the patient. So not only the weight gain, the weight loss more than 1.5 kg per week, it will also lead to gallstone formation. So everything put together, obesity, diet, that is due to intake of unhealthy, high caloric, highly fatty food, and also due to the sedentary lifestyle, which is a new smoking. Sitting is a new smoking. All this causes gallbladder stones. The patients or the people who got obesity, very bad dieting, and also very bad lifestyle, they are more prone for gallbladder stone formations. So does it run in family? So many patients ask, does it run in family? So my mother had gallstones, whether I will get? Yes, sometimes 30% of a genetic component is present in the gallstone formation. Especially the bile absorption in the intestines causes increased gallbladder stones. But I would like to concentrate more on the diet and lifestyle of the people rather than thinking about the genetic component. That's all. But also, does the size of the gallbladder matters? The size of the gallbladder doesn't matter. A large stone can cause without any symptoms. A small stone can cause more complications like empyema, obstruction, giving rise to pyocele, mucocele. So the size of the gallbladder doesn't matter. This is the one thing. Next thing which I like to tell is how the gallbladder stones, whether it will cause cancer. Even though there is no a direct correlation between gallstones and gallbladder cancer, some of the factors have been identified, like big stones more than 3 centimeter, more than 10 to 20 years of stones, and family history. Those patients are at high risk of getting gallbladder cancer. One need to remember 4F, that is female, fertile, 40 and fatty. Female, the gender is more important in gallbladder stones. Almost females are 3 times more likely to have a gallstone formation than the men. Yes, fertile, especially pregnant ladies, due to hormonal alteration in the estrogen and progesterone, that will cause gallbladder stones. And also the fatty food intake, high calorie intake in pregnancy will also one of the important factor causing gallbladder stones. Next is 40. Postmenopausal females, ladies, they have decreased estrogen level. That is also one of the cause for the formation of gallstone diseases. Fatty, already I told, the increased weight gain, especially the central obesity, is one of the main factors for the formation of gallstone disease. So, female, fertile, 40, fatty, these things if you remember, then it is more, you have grasped something about gallstone diseases. Another important thing which I like to bring is diabetes. Diabetic patients, especially those who have got uncontrolled blood sugar, they are more likely to land up in complications due to gallstone diseases. Previously, even the patient who was asymptomatic gallbladder stones, in diabetic patient we used to operate. But nowadays, we take an experimentally management, an individual tailorized management for the diabetic patients. Why I am stressing about diabetes is, the diabetic patients, when they have uncontrolled blood sugar, that itself act as a nutrition for the gallstones, because the gallstone itself has got itself act as a nidus for the infection. So this infection and the flourishing nutrition caused due to increased blood sugar, that is also as a good environment for the bacteria to grow and cause more sepsis. So the diabetic patients more likely to have more complications like empyema gallbladder, like the gallbladder itself will be filled with pus, or gangrenous gallbladder, or emphysematous gallbladder. These are the conditions which needs the urgent laparoscopy, urgent or emergency laparoscopy investigations, because this will cause more morbidity or more mortality in these patients. So these are the two subset of patients, especially diabetics and pregnant ladies. They need to be very careful about the gallstone diseases. They need an expert opinion, especially the surgical gastroenterologist opinion for the management of this one. You might think, what is that is only gallstone disease? It's not like that, because that will cause more complications. The complications if it is unattended or it is negligible, then the patient is likely to have a cholangitis. That is an infection in the bile. Infection of the bile, the fluid itself will get turbulent or a relentless infection. It has to be managed within 48 hours. So it has to be dealt within 48 hours to control or to reduce the sepsis. So that's one important factor due to the infection of the bile that is caused due to gallstone diseases. Another one important thing is jaundice. When the stone is within the gallbladder, it obstructs the gallbladder and causes the localized complications like empyema gallbladder or pyocele or mucocele, that is within the gallbladder. So when it obstructs the neck, it acts like a ball valve movement. Once it obstructs, it causes symptoms. Once it goes back, it doesn't have any problem. Then the patient will be free of pain. The patient will think, okay, it is getting reduced, I'm all right. It is not like that. The patient is more likely to have another episode with increased severity, with increased frequency. So that will also cause more pain, more colicky pain. So the patient will likely to have a localized complication. This can be dealt. But when the stones, the smaller stones, when escapes from the gallbladder stones and it obstructs the pathway from bile from the liver, then the patient is more likely to have an obstructive jaundice. In that time, a simple procedure of 1 or 2 hours and stay for 24 to 48 hours, then it turns into 2 procedures. That is, you have to deal the common bile duct stones and also the gallbladder stones. So the 2 procedure, instead of 1 procedure, 2 procedure, 2-day stay becomes a 5-day stay. So these are the things you'll be yourself will be multiplying the complications. Next is empyema gallbladder. That is due to the gallbladder itself will be filled with pus due to the infection, due to the obstruction by the stones. Both the things when it combines, then it causes an empyema gallbladder. The pus is because of the secretions in the gallbladder, that itself getting obstructed, then it becomes a pyocele. That needs an urgent intervention by laparoscopic means. Next, coming to gangrenous cholecystitis, gangrenous gallbladder. Especially this is more common in patients who have got severe infections, especially diabetic patients, those who got uncontrolled blood sugar, they are likely to have a gangrenous gallbladder. That is, the full thickness of the gallbladder itself will get necrosed or dead. And that dead portion may not be able to contain the infection. Then it gets perforated. The perforation gets escape of bile from the gallbladder, and it gets accumulated around the gallbladder, forming the pus or abscess. That causes localized peritonitis. So these sort of things will happen, especially in diabetics, those who have got uncontrolled blood sugar. That has to be dealt immediately. Urgent laparoscopic intervention. And antibiotics has to be given to control the sepsis. So it should not become a generalized peritonitis, then the sepsis will increase to the whole body. That should be arrested with the eye antibiotics and followed by that laparoscopic cholecystectomy as soon as possible. And next, coming to emphysematous gallbladder, that is, the patient will have a infection due to the gas forming agents. This is also more common in the diabetic patients, and they are likely to have a perforation. Again, the problem due to the gangrenous gallbladder will happen. So these are these things which can be dealt with, is under our control. But when the gallbladder escapes us from the gallbladder, the stones escapes us from gallbladder and obstructs the gallbladder pathway or the common bile duct, they will likely to have a surgical jaundice. This is also under our control. But when the gallstones or the stones goes and obstruct the common duct, formed by the CBD, that is common bile duct, and the pancreatic duct. The pancreatic duct is also obstructed and common bile duct is also obstructed. The patient is likely to have a pancreatitis, gallstone induced pancreatitis, which is not at all under our control. The patient will likely to affect from the pancreatitis, that is infection due to the infection of the pancreas. Then they will land up in a fluid accumulation around the pancreas, pancreatic collection, pancreatic pseudosis, pancreatic abscess, pancreatic necrosis. That will lead multiple procedures of draining the pancreatic abscess, draining the pancreatic necrosis, necrosectomy. Patient will have even the ICU admissions. So those patients will likely to have more complication, more hospital stay. A simple gallbladder stones can wreak havoc, can cause a lot of complications in these patients. You may not be thinking, what is this only gallbladder stones? It can be dealt easily by anyone. It's not like that. When they have more complications, even the expertise will find it difficult to treat the patient because of increased complication, ICU admissions, a prolonged stay, even for a month together, they need a treatment for pancreatitis and then go for a lap cholecystectomy. So the one procedure becomes a multiple procedure, multiple admissions. That's what I am telling you, and I like to stress in this video or in this bird eye view of interview that the patient of gallstone disease, they should not neglect the disease. They need an expert opinion, an expert management, a holistic approach to the gallstone diseases. And what will be the signs and symptoms? How the patients will come? That you would like to know. The patient will have a right upper quadrant pain, and that will be a severe pain. The patient will not forget that pain. So you will clearly remember the time, date of the pain. That's why the patient will say, sir, I suffered during this month, this period I have severe pain. Initially the pain will be an intermittent colic one. So they may not remember, but once the stones obstructs the duct, then they will have severe pain, a constant pain that they won't forget. And there is an infection, then the patient will have fever also. So these are signs and symptoms which helps in the diagnosis of the patients. Then the patients can be sent to the investigation for confirmation of the diseases. Especially the lab tests, common blood tests will be done. The liver function test plays an important role in knowing whether the patient should go for CT, whether he should go for MRI. So that will also help when the patient have jaundice, obstructive jaundice, then the patient will like to go for MRI rather than going for the CT abdomen. So the MRI gives a clear picture of the gallbladder and also the pathway and also any pancreas. Even CT will give a clear picture, but when they have more complication, better to go for an MRI with the MRCP of for the patients. Coming to the management of gallbladder is, especially the patients will likely to have or they don't want surgery. One thing I would like to tell is the medicine is unlikely to dissolve the gallstone diseases, because lot of studies, lot of researches has been done, and patients take given by the alternative medicines, they take alternative medicines, whatever medicine they take, it is not going to help them, because the percentage of stones getting dissolved by the medicine is very much negligible, and the rate of dissolve or the pace of dissolvement is very, very slow. So it will take decades to dissolve the stones. Before that, the patient will land up in all these complications like cholangitis, obstructive jaundice, surgical jaundice, or common bile duct stones obstruction, or the patient will have empyema gallbladder, gangrenous gallbladder, or emphysematous gallbladder, pancreatitis, pancreatic pseudosis, pancreatic collections, pancreatic necrosis. So the important role is played by the surgery, especially laparoscopic cholecystectomy, which is the gold standard a treatment for the gallstone diseases. Why the laparoscopy has become a gold standard? Because this is the first surgery for which the gold standard or the each and every steps has been defined in the laparoscopy. The first surgery to be defined with so much of steps in the laparoscopy. So laparoscopy will also help in the patients have a small incision also, only 5 millimeter, 10 millimeter. Sometimes we will go for a single port. Only a single port will be used to treat the patient, especially in uncomplicated cases. So laparoscopy, why do you prefer laparoscopy? Because it causes a small incision, less blood loss, less scar, so less pain, so yearly recovery, yearly intake of liquids, yearly mobilization, so quick recovery and quick, you can join the duty yearly also. So these are the things, and it helps in reduces the shortage, shortage in the hospitals. So the quick recovery is because of the laparoscopy. Some of the patients won't feel the pain also. So it's a very important surgery which helps in dealing the or coming out of the gallstone diseases problems. We at VS Hospital, a multi-speciality, a super speciality hospital, has got a well-defined, well-equipped hospital which has got not only the skill of the surgeon, but also the gadgets, high-end gadgets are available to deal all the complications in our OT. Not only the staffs, not only the surgeon, not only the gadgets, but also the compassionate care given by the staffs, that also helps in the quick recovery and holistic approach to this problem. Thank you. Thank you for your patient here.
VS Hospitals, care, cure and compassion.